Good afternoon, everybody, and welcome back to the Watercooler. It's episode number 45. It's March 17th, and that makes it one day out of the calendar. It's St. Patrick's Day. Happy St. Patrick's Day to everybody. And yes, you read correctly at the bottom little scroll bar on our little ticker here. This is a special, very special episode. I know I promised a couple of weeks ago that we'd have some special guests, and I always fulfill my promises. Thank you, everyone, for tapping in right now. And we're going to have two special guests. Since I didn't have any special guests last week, we're going to have not one, but two special guests this week. So without further ado, I'm going to bring in our first very special guest. You may know her as Julia, because that's her name. So we're going to bring in Julia, reference librarian extraordinaire, Julia.
Hi, everyone. Yeah, I'm Julia, one of the librarians here at McAllen Public Library. This is my first live video. I've done plenty of recorded ones by now, but this is the first live one. So a little nervous, but I think it'll be fun. And we're here to introduce a very important guest. In case you don't know, right now is a very important time of year. It's open enrollment for health insurance through the Affordable Care Act. So we're presenting Gabriela Cortez from Nuestra Clinica del Valle, and she's going to tell us all about how open enrollment works and different services that Nuestra Clinica del Valle has for the community.
So let's everyone have some claps in the chat to introduce Gabriela from Nuestra Clinica del Valle.
Hi, good afternoon.
Hi, Gabriela.
How are y'all? Thank y'all so much for letting me join y'all this week.
For sure. Yeah, so just preemptively, can you tell us a bit about Nuestra Clinica del Valle before we get into your info?
Sure. So Nuestra Clinica, and this will be on my presentation as well, but Nuestra Clinica is a nonprofit community health center with several locations across the valley. So if there's not one, if you don't live in McAllen, there's probably one near you. We have a number of services and different health and wellness services that we offer. And I'm a part of the Outreach and Enrollment Department, so I'm here to talk a little bit about our health coverage options and health insurance marketplace.
Awesome. Cool. So what do you all say? Should we get right into it?
Yeah.
Gabriela, I know you prepared a very extensive little info presentation here. So I'm going to go ahead and share it. You ready for it?
Yeah, I'm ready.
Let's get it.
Okay. Does it look good on your end?
It's loading now. I'll let you know when it's good. Oh. Oh, she'll be back, I'm sure.
Yeah.
So, Julia, how did you reach out to Nuestra Clinica del Valle at first?
Well, we knew that this time of year was open enrollment, so we were looking for different community organizations that we know help with it. And I was already familiar with some of the services from Nuestra Clinica del Valle. So we reached out to them and a few others like MHB Salud and forming partnerships to better serve our community during this important time of year for open enrollment, because health insurance is very important.
Definitely, yeah. And I know you mentioned a little bit that they offer healthcare marketplace assistance. Oh, and here comes Gabriela. She's back.
Okay, I'm not sure what happened. Let's try that again.
Yeah, let's try it again. It's no big deal.
Okay.
We were just talking about how important it is to at least inform people about the healthcare marketplace and the different types of resources that they can use. Oh, here we go. Nice. I see the screen here. Here it goes. Okay. There's double us.
Cool. Okay, let's try this again.
Reoccurring viewers of the Watercooler know that we have technical difficulties all the time, so no big deal.
Okay. Is it okay if I go ahead and get started?
Yeah, for sure.
Okay, perfect. So thank you all for having us again. Again, I'm here with Nuestra Clinica del Valle. I'm a part of the Outreach and Enrollment Department. And so we already kind of talked about we're a nonprofit community health center with 11 RGV locations here across the valley. So as you can see, our mission is to provide comprehensive, patient-centered primary care and to cultivate partnerships between our patients and their health providers while excelling at customer service. And just a heads up, this whole presentation is both in English and Spanish. I'll be presenting in English, and hopefully everyone can follow along. Okay.
For sure.
Okay, so here are some of our Nuestra Clinica services across those 11 locations that we have. As you can see on the left, we have medical services, gynecology services, dental services. And the important thing to know about our clinics, there at the bottom left-hand corner, is that fees for services are based on income and family size. So it's going to look different for a single individual or maybe a household of 5 or 6. So feel free to call one of our clinics, see what fees of services would look like for you, and we can go ahead and give you the best information as possible. On this right side, we also have social services, immunizations, pharmacy, labs, radiology, education on diabetes, and then the bottom little note is our outreach and enrollment, which is what we'll go ahead and dive into right now. So our outreach and enrollment services are free to our patients and free to the community. And so on the left side, those are our 11 clinics that have an outreach worker and outreach services. We do travel and we try to go into different communities to provide more information about coverage options or different applications we have going on. But we have outreach workers in the San Juan, Mission, Mercedes, Rio, and Roma clinics. And the applications that we usually help with, they're all listed on the right side. So we assist with the Hidalgo County Indigent Program, Medicaid, TIP for Children, SNAP, which is the Food Assistance and Food Benefits, previously known as food stamps, TANF, which is cash assistance, and then lastly, the Mercado de Seguros, the health insurance marketplace, which is what we'll get into right now. And again, feel free to call any of our locations and we'll try to best fit your needs and figure out exactly what you're looking for. Okay, so for the health insurance marketplace, like Julia was saying, we're currently open. We have a special enrollment period open again. Our open enrollment periods open during the fall and winter of each year. But this year, they opened it up again from February 15th all the way to May 15th. So we have a little under 2 months. If you don't have health coverage, if you know family, friends, or anyone else send them our way, and we can assist the best we can. If you'd like more information before you call your patient, you can feel free to call, or you can feel free to look at healthcare.gov, which is the website with more information. And it's actually the site that we use to do the applications online. So here are 3 requirements and documentation for our 3 health coverage options that we have at the clinic. As you can see, going from left to right, the required documents are a little bit longer from the Hidalgo County all the way to the health insurance. And they're just different requirements. For each insurance is also dependent on what your needs are and what your family's needs are. So to focus on the health insurance marketplace, which is on the far right, the most important, well, all of those documents and information, but the main things they focus on is if you're eligible for the health insurance marketplace plan, and if you qualify for lower premiums each month, is your income for this year, 2021, your family size, and how you file your taxes. So, for example, a single individual with no children, no dependents, that maybe makes like $20,000 a year. It's going to look different. Their monthly premiums for health insurance are a little different than a family of 6 that makes $35,000 a year, right? So we try to take all of your information and put it in the application, and we try to find a plan that best fits your needs and best fits your price range as well. So I'll leave this up for a little bit. I'll go back to the English one so you can look at the documents again.
Cool. And sorry, just a quick question. What do you think is the most the question you get asked the most about the healthcare marketplace or the health insurance marketplace?
Sure. Yeah. The question I get asked the most is how much are they going to pay for a health insurance per month? And I guess the answer that I give pretty often is that it's hard for me to determine how much they'll pay. And I guess to clarify, the Outreach and Enrollment Department, we help with application assistance. So to fill out applications, to submit them, but we don't determine eligibility. So I usually, with that question, if someone calls and asks how much they'll pay per month or how much I think they'll pay, I just kind of refer them to this income and family size chart that I'm about to show y'all. And then we'll complete an application. And then pretty immediately, once we complete an application on healthcare.gov, we'll be able to see if that family or that individual qualified for lower premiums and then how much they'll pay. That individual family can decide that they don't want to enroll in a plan, and then we can just leave that application as is. I guess so. Another question I get a lot is if a family or person does an application, if that's kind of like if that is an automatic enrollment. So some people just want to know if they're eligible without actually enrolling. So I just try to clarify that the application and enrollment are 2 separate processes, and you can apply without actually enrolling in a plan if you're still not sure. Does that answer your question?
Thank you. Yeah, perfect.
Okay. So how do you know if you qualify for lower premiums each month? So before we do a marketplace application, this is a good chart to refer to, and there'll be more resources available after this presentation. But you can see on the left-hand side is the household size, and then on the right-hand side is the 2020 income, or your expected 2020 income this year. So the application is going to ask for what you think you're going to make this year, 2021. And so again, like I was saying previously, individual would have to make between $12,000 and $51,000 per year to qualify for lower premiums, and then a family of 6 would have to qualify for would have to make between $35,000 and $140,000 a year. So everything really just depends on your situation. But again, we can walk you through the process. We're pretty friendly out here in the outreach department, and so if you have any questions on maybe you have 3 part-time jobs or a job that doesn't offer or provide very official paycheck stubs, we can figure out a way to get the most accurate or the best income documentation so that we can apply for this health insurance marketplace. And just to reiterate, the special enrollment for health insurance marketplace does end May 15th. So give us a call if you have questions, concerns, you're just not sure. We can see if we think you'd be eligible or qualify for health insurance marketplace. And if not, then we can set you up with the county application or with the Medicaid application, or if you need assistance with the SNAP food assistance or TANF cash assistance. Call us for whatever you have questions about.
Well, thank you so much for telling us more about this.
Yeah, of course. Here are 11 locations. And again, just to reiterate, we have our 5 outreach locations, which are the San Juan, Mission, Roma, Mercedes, and Rio. So yeah, feel free to give us a call.
That was really good. Thank you, Gabriela. A lot of really
so much.
important information there. Is there a phone number that's on there as well?
Yes. These are our clinic.
Yeah, there they are. Yep.
Mm-hmm.
And also, if you go to the McAllen Library website, mcallenlibrary.net, on our homepage, we have a link to some of these flyers that have some of these numbers and this information.
Yeah, and so these are our the actual clinic location, our clinic numbers. So you can call the number and ask for the outreach worker, and again, ask how you can become a patient. But ask for the outreach worker, and they'll send the call directly to us.
Awesome.
Mm-hmm.
So how long do you think how long would you say the application to enrollment process lasts?
Like to complete it fully?
Yeah.
It varies. So I've noticed that for a single individual, it might take, if they have all their income and employment information handy, it'll take anywhere from like 20 to 30 minutes, maybe 25.
Wow.
But for a family, a larger family, like a 5 or 6, having to put in birthdays, address, socials, different incomes, sometimes it can take up to like 45 minutes. So it just varies on how, if the individual or family has all of their information kind of ready for the application. But if not, I'm always willing to do it in two appointments.
Yeah.
Mm-hmm.
And then once I guess my question really was, once they submit an application, how long until they know they have a full coverage or a type of coverage?
Yeah. So the really cool thing about the healthcare.gov for this application is that immediately. So we submit your application, we electronically sign for the patient, and then your application results will pop up. And on that results page, it will show if you qualified to enroll in a plan. It'll also tell you if you or any of your other family members might qualify for Medicaid. And so they automatically send your information to the Medicaid office. And then if you do qualify for Health Insurance Marketplace, it'll tell you how much they'll assist you with the lower premium. So they'll give you an actual dollar amount. So it'll say something like, it'll have your annual income of $28,000, and then it'll tell you that you qualify for $300 to be deducted from your monthly premium. So it gives you all the information immediately, and then we can immediately look at your health coverage plans and options. And there's typically 3 different health insurance companies. There's Molina, Ambetter, and Blue Cross Blue Shield. And so you can immediately start scrolling through this long list of different plans. You can see the deductibles. You can see what the prices will look like for you. It's kind of all right there. It's really accessible and really user-friendly.
Yeah, I think that's probably something that a lot of people have maybe they think about it incorrectly. Like they think like, oh, it's going to be a long process. Mm-hmm. By the time they get back to me, or like they're expecting something in the mail. But yeah, you're saying it's all done right there and then?
Yeah, exactly. And I know there's like some concern if some people don't have computers or don't really know how to use, an internet or a website like that, which is why we have our outreach department to assist with that. And I've noticed that the part that takes the longest is typically the individual or family trying to decide which plan they want to enroll in. So, I sometimes will give them a couple of days or a week and then call back and see if they have any other questions or, so yeah, but everything else is fairly quick actually.
Awesome. Yeah, great. Julia, did you have any questions for Gabriela?
No, this is all very interesting. I didn't know myself that it was that quick or easy or simple.
Yeah, it is definitely.
I think I might have one last one, but so let's say you have a relative who doesn't like to travel well, or they are maybe homebound, or I don't know, they're in quarantine or something. Would they be able to still do it maybe virtually if you set them up virtually, like an appointment session like this, would they be able to set it up virtually, or would they have to come in person somewhere?
Yes, thank you for thank you for asking that. Because actually this past winter or this fall and winter and currently we're doing all health insurance marketplace applications over the phone. Since we still have limits to who we allow in the clinic, and we still have, all patients are required to wear masks, and I'm not allowed to have any patient in my office still at this point. So everything is done over the phone. We just, make sure that the patient understands that we keep all their information confidential and that they allow and permit us to sign electronically for them. So we walk them through each step. So yes, so we can definitely do it over the phone. I've also done applications through like Zoom, kind of FaceTime, if the patient wants to be able to see exactly as I'm working in my office and do that kind of interview application assistance. So it's up to the patient, but for this, we actually are pretty strictly over the phone.
Awesome. Yeah. Mm-hmm. I'm glad I asked. Then yeah, it's a lot of people are doing stuff virtually now. That's pretty much why we started this this live stream, because a lot of our programming went away during this whole pandemic, and little by little we're going to start doing in-person programming again. But yeah, we've all had to migrate over to YouTube and Facebook live stream and all kinds of stuff.
Exactly. And such a good resource, an alternative.
Definitely, yeah. And you can reach a lot of people if you have people to share, like your link or a stream or a video or anything. It's just the amount of people it can reach is awesome. So hopefully a lot of people get to see this. And if you have any like just parting words for people, we can share them now. And I think, we're about 25 minutes in, so we can probably end on that. We'll give you all the last word.
Sure. I guess I'd just like to say that, health insurance marketplace isn't as intimidating as you might think it is. And we're here to help you every step of the way in the process. If there's confusion, if you have questions about benefits and insurance plans, we can help be that friendly face to walk you through this, this umbrella that is health insurance marketplace. But call or reach out. We're here for you.
A perfect way to end. What do you think, Julia?
Yeah, no, this is great. This was so interesting and helpful. Thank you for joining us for this.
Of course.
And I think that's about a good stopping point there. Everyone check out Nuestra Clinica del Valle if you have any marketplace needs or questions. Thank you one last time to Gabriela for joining us this week. Hopefully we can have you again at a different time, maybe do an all Spanish session or an all Spanish info session. But thank you so much.
Yeah, of course. Thank you.
All right. Thank you.
All right, everyone. Everyone have a good rest of your day. Thank you for joining us and comments, and make sure you share and like and subscribe to our YouTube, do all that kind of thing. MPL Adults. Everyone say goodbye.